Welcome back. Well, for many of us, we're just starting to hear really about what this new technology is all about. And there are a group of doctors who are using something called stem cells to help treat patients. Part of that team joining us now to talk a little bit more about this is Dr. Louis Obi, a plastic surgeon. He is joined by Dr. Kenneth Eady, who specializes in internal medicine and pain management. And also joining us is Sean Eam. He is a STEM research specialist. You guys are all a part of the Pangenics Regenerative Center. Gentlemen, it's so good to see you. Thank you for being here. Let's start off with that question. What in the heck is Pangenics Regenerative Center? What does that mean?
It's a combination of two words. Peter Pan never gets old. Genics regenerate, and that's the whole concept of stem cells. And coincidentally, we're born with most of our stem cells located in the superficial fat of our bodies, and it's very easy to access. And as plastic surgeons, we've always encountered fat in our specialty.
Let's kind of go in depth with stem cells, right? Where they come from, what are stem cells, and how are they now being used, especially in the field of plastic surgery?
Good question, Casey. We're formed by two stem cells, an egg and a sperm. And at birth, 99% of our stem cells are located in the superficial layer of fat. And the concept of, as a physician, we want to heal, do no harm. And instead of performing invasive surgical procedures and exposing our patients to potent drugs that have side effects, now we're trying to access the patient's own cells to heal and regenerate.
Okay, so we're grabbing these stem cells from the fat, right? The
Yes.
stuff I don't really want anyway. So you're using these in a beneficial way. And how so? In what procedures are you using these stem cells when it pertains to plastic surgery?
Well, for decades, I've used them in plastic surgery, primarily in the face and body, areas like the breast and other areas of the body. It has a structural function as a graft, but it also has cellular function because it contains most of our stem cells. So now I've brought together Dr. David Heekin, orthopedics. I brought together Kenneth Eady and also Dr. Floridi, different specialists all under one roof that will treat their patients with stem cells. And more recently, I brought in Dr. Sean Eam, from Seoul, Korea, as a researcher.
And gentlemen, I promise we'll get to you in just a second, but I have one more quick question because I'm sure this is on the minds of a lot of people out there. Are these safe? Are stem cells, obviously you're using them in your office, so I'm assuming, yes, they are safe to use.
As a member of Cell Surgical Network, we have a database of 6,000 patients with the IRB Institutional Review Board. The purpose is to study safety and efficacy. Over the last several years, with 6,000 patients, we've had no serious complications. We're actually only using your own cells around your fat, and so we're using your own cells. So it's been proven to be safe.
Okay, Dr. Eady, let's bring you into the conversation, sir.
Great.
Let's talk a little bit about pain management. How do you use stem cells then to help patients manage their pain?
Well, injury to bone, joints, cartilage, ligaments, tendons all promote pain in an individual. And as such, we use stem cells to regenerate that tissue, both intravenous as well as injected directly into the tissue that's been damaged. What this does is it both regenerates tissue, decreases inflammation, and in the case of joints, it actually replaces that joint fluid. So, or we hope that it does.
Sure.
And this can be done in any joint in the body, from the shoulders to the spine, to the discs of the spine, all the way down to the feet.
What about diseases, too? You hear about stem
Right.
cells being used to help diseases like COPD and rheumatoid arthritis.
Right.
How is that, and quickly, how is that happening?
Well, in the case of autoimmune diseases, the body attacks itself. So it feels as though some portion of our cells are infection or tumor and tries to attack it and remove it. This is inappropriate response, causes significant inflammation and pain. In the case of lupus, this can be any organ, rheumatoid arthritis, any joint, ulcerative colitis, Crohn's, this can be essentially the bowel. What this does is it causes tolerogenesis, or a reduction locally in the immune response to those tissues. It regenerates, the hope is to regenerate tissue as well as to decrease inflammation and to reduce the reliance on these toxic medications that are taken regularly for these conditions. In the case of COPD, it's to replace damaged tissue and to improve the ability to get oxygen into the blood and carbon dioxide out of the blood, and overall to prevent the steady progression of the disease that is COPD.
And Dr. Obi, you say all of this is backed up by research, and kind of introduce us to Sean Eam as well, and how he plays a role in a lot of this.
Sean Eam joined me in September last year. I've worked with his boss, Dr. Young Lee in Seoul, Korea. Dr. Lee, coincidentally, is one of the pioneers in the area of stem cells. He established Medicon. He and Dr. Yoshimura in Tokyo have led the field of stem cells. Sean actually works with both of them. He's been with them for 10 years. So I've known these people for 10 years, and I've worked with them for 10 years. And Sean came over to assist me in the research area.
Yeah, and talk about the research. Talk about your contributions to trying to use stem cells to now treat people in so many different fashions, from plastic surgery, pain management, what have you.
So actually, I work with Dr. Hyun Lee over 10 years. And now we are internationally collaboration with the Korean, the lab tech, and here. So
Yeah, yeah, I know, and
Yes.
welcome to the
Yeah.
United States. By the
Yeah.
way, I know that you joined the team, and so how can people learn more? Like, they're learning about this. Some people, they've never heard of this. This is a new technology to them. So what is the best way for people to learn about this
Well,
innovation?
coincidentally, we're putting on patient symposiums. We have one, in fact, this coming Wednesday evening. This is the third one. From the provider standpoint, the physicians, we sponsor international symposiums. We've done 2. We have a third one coming up this year. Dr. Lee participated in the one we did in February of last year. And so if they go on our website, we have 2 websites, one for the stem cell side and one for the plastic surgery side. They can learn about it. Also come to the symposiums.
There you go. Gentlemen, so good to see you. Thank you for taking the time to come. Appreciate your expertise. Now, as they say, back to work, right? No time for lunch.
Okay.
And we'd like to thank, of course, OB Plastic Surgery Clinic for making this content possible. To learn more about the Pangenics Regenerative Center and stem cell treatments, you can do so by visiting stemcellsurgeryflorida.com. You can also call the number that is right there on your screen, 399-0905. Okay.